Thank you for such a warm introduction. Can I have my slides? So, at the IPAC Foundation, the heart of our mission is simple: to cure the mindset. We must stop waiting for the illnesses to strike and start preventing it before it begins. Ladies and gentlemen, it's time to shift from cure to prevention. And that shift should start now. For centuries, humanity has recognized a simple truth: prevention remains the strongest foundation of lasting health. Long before modern medicine, civilizations recognized that prevention begins with public health. The Romans engineered aqueducts and cloaca maxima to ensure clean water and sanitation, while medieval Europe, in the wake of Black Death, discovered the life-saving impact of quarantine. Hippocrates, the father of the medicine, championed the idea that lasting health stems from balance in diet, exercise, and lifestyle. In ancient China, the essence of medicine laid in prevention, captured perfectly by the proverb: the superior doctor prevents disease, the inferior doctor treats it. With the arrival of Islam, prevention becomes a divine principle. The Quran declares, "Whosoever saves one life, it is as he has saved all the humanity," and warns in Surah Baqarah, "Do not throw yourself into destruction with your own hands." The Prophet Muhammad reinforced this by teaching cleanliness is half of the faith. Ladies and gentlemen, prevention is an act of obedience to Allah. In the Islamic Golden Age, visionaries like Al-Razi and Ibn Sina advanced preventive medicine through hygiene, quarantine, and diet regulation. Their works, Kitab al-Hawi and the Canon of Medicine, shaped European medical practice for generations. Unfortunately, Pakistan is confronting a widespread yet preventable health crisis. Millions suffer from diseases like hepatitis, tuberculosis, waterborne infections, conditions that prevention can control. I will share some of the data that illustrates how severe this challenge has become. Speaking of hepatitis, 1 in 7 individuals in Pakistan now has hepatitis C infections. In some areas, like southern Punjab, this ratio is far higher than 1 in 7. And almost 20% of the population in some areas in southern Punjab has hepatitis C. 10 million people await treatment. The causes: unsafe injections, unsterilized instruments, quackery, unscreened blood, inadequate hygiene, entirely preventable. Behind each story is a story of suffering. Treating Pakistan 10 million hepatitis C patients, Azerbaijan, would cost anywhere from $600 million to $2.5 billion. And yet, can I have the next slide? Pakistan reports 470 new cases of hepatitis C each year. Without halting new infections, it's like trying to put out a fire while pouring fuel on it. With a health budget of 3.2 to 4.2 billion, we spend less than 1% of our GDP on health. Prevention remains the only viable solution. Speaking of tuberculosis, Pakistan ranks 5th globally for tuberculosis, recording over 564 cases in 2022. Again, prevention is possible through early screening, simple hygiene practices like masking, covering cough. Each year, 53,000 of our children die from diarrhea. If action is not taken, ladies and gentlemen, you can see in this table, all the disease numbers will double by 2050. And yet, prevention struggles for attention. Why? Because it's invisible. Requires long-term investment and competes with a culture drawn to quick fixes. It's time to shift our mindset, to prioritize prevention before crisis. In Pakistan, many still rely on quackery and unqualified healers who promise quick fixes but causes lasting harm. You must have seen all these images and wall chalking in Pakistan. Ladies and gentlemen, we realize in IPAC Foundation, investing in children is our way to solve this problem. Investing in children builds lasting health, social change, early prevention builds lifelong habits, influences families and communities, and reduces future healthcare costs, creating both generational and economic benefits. Ladies and gentlemen, Pakistan health challenges many, but they are not impossible. The future of Pakistan lies not only in the hospital and medicine, it lies in our schools, our homes, and the choices we make every single day. Let's together pledge to spread awareness, to educate our people, to empower every citizen, and to embrace healthy behavior. This is not just a health agenda, this is a national movement. This is our way forward. Thank you. Pakistan Zindabad.
My name is Sakina Batul, and as you mentioned, I'm a neurology resident at Indiana University School of Medicine. My journey with IPAC began in 2017 at Fatma Jinnah Medical University, when I joined its volunteer wing, Volunteer Force Against Hepatitis Transmission, also known as VFOT. I've been a part of VFOT throughout my 5 years of medical school and through its various projects that has contributed to my personal as well as professional growth profoundly. And as we gather tonight for this fundraising gala, I invite you to join hands with me in this one powerful mission to prevent infections before they happen and to save lives. IPAC is a non-profit foundation that believes that healthcare should begin long before a patient reaches the hospital. We are trying to lead a shift from treating disease to preventing it before it happens, creating a culture of care that is sustainable.
Also, map community needs, educate families, and empower them to adopt preventive measures. Alhamdulillah and chant cities of Punjab. None of this could have been possible without the dedication of our team and support of our board members. At IPAC, we understand that every contribution carries our responsibility. Stand with us, continue this journey, and help us build a healthier future. Thank you for being here tonight and believing in our mission. क्योंकि एहतियात इलाज से बेहतर है.
My name is Reem Shafi. As a dentist who has been practicing in the United States, I have seen what safe, preventative, and modern dentistry can achieve. And yet, every time I visit Pakistan, I am reminded of what happens when access and awareness is missing. Over 90% of Pakistanis will experience some kind of dental disease or an issue in their lifetime. A small cavity becomes a painful infection, and an infection turns into pain and finally tooth loss. And what begins as a simple toothache becomes a lifelong burden of hepatitis C due to improper sterilization of instruments and reusing of needles.
Diabetes has always been personal to me. It is not my profession, but it is my passion. Coming from a family with several family members affected by diabetes, my passion deepened when I lost my father to complications of diabetes, like going on dialysis, having cardiovascular disease, and was about to lose both his feet, but he died shortly before that. This inspired me to found the Kisset Diabetes Organization, a non-profit dedicated to early screening and education for the underserved communities. Many of you have supported our initiatives for past 10 years, and I'm extremely thankful to you for that. During our educational sessions, I recognized a major gap in awareness and understanding of diabetes. which led me to write my book, Diabetes Beyond Numbers. During COVID pandemic, I started a virtual diabetes clinic that unexpectedly connected me with a lot of people from Pakistan, revealing an even bigger and greater net of resources and knowledge back home. When Dr. Shafi proposed integrating diabetes program into IPAC, it aligned perfectly with my long-held vision.
Turns out we lived on the same street, Harley Street in Rawalpindi. So this was a divine intervention for me to be here. And it's a little bit of nepotism that we didn't even know was playing a role. Ladies and gentlemen, I had a very quick certificate of Jamaat-e-Islami in Punjab University in Chemical Engineering, otherwise known as Hundaism, because that's all we learn over there while you're Jamaatiya. And then because I had no money, I come from a very underprivileged family in which nobody went to college, my only ticket to being here today was education. And there was no better country in the world than the USA. Problem was, slight one, I didn't have any money. So I landed in the University of Oklahoma with $50, and I got a degree in dishwashing and pizza delivery, otherwise known as computer science by some. Because I was such a pathetic student, thank God, what a blessing, because if I was a good student, I would have gotten a job somewhere, I may still be working. So most people who are not very good, they don't get a job, they give themselves a job called entrepreneurship. It just worked out.
The Shafi family, Samir Rai, Sohail Rai, Reem, and Masuma Babi, for the outstanding effort that has been made today. This is not curated, I'm just speaking from my heart. I think so many of us are drowned in life as we speak. I mean, I barely made it here on time. And there's somebody else here in the community who's not only making it here, but organizing all this. And then you listen for the past hour and you realize that the magnitude of effort, time, breadth and depth of what has gone into this.
One more. One minute.
शिकागो मेयर के लिए।
गरीब लोग हैं भाई।